So the template design, a lot of people ask, what is the template? What do we use it for? And basically, the template is two things. It is a, hi Galt, this is a decision support tool. It is not a decision-making tool. It helps us make decisions. It's a decision support tool, and it's a documentation tool. So it's basically a tool to help us look after patients better. If we have a look at the chronic pain algorithm, which is part of the PSP, so this is the flow sheet from the EMR algorithm, and you can see it's divided into these different sections as we talked about. You know, it's the assessment piece, red flags, yellow flags, and then these two green boxes are really your treatments. So using this design, we decided to move forward with this as our template. So what I'm going to do now is hopefully show you the template. So this is Mickey Mouse. He's come in with some gluteal pain today, and this is basically the daybook that we're seeing at the beginning. To open up the template, we'd basically open up like we would a normal encounter. We'd have our progress note here. And then we'd see under encounter forms, like you would do for a hypertensive template or a diabetic template, you'd create a new form here. And right down here is pain assessment. Okay. So we'll just let this load up. So the colors, which are not really nice up there, but here it looks very similar to the PSP flow sheet. And moving forward, and from the top, we have the pain assessment tool. So I'm just going to dive in and show you what exactly we have. Right on top here, we've got the generalized anxiety disorder, JD7 tool. We have this little 3 dots, which is called an ellipse. I learned this myself quite recently. And if you click on that ellipse, it brings up your JD7 sheet. And so you can actually put in what the patient put in. It also shows you what the last time they did it, what their scores were on each particular one. So each one of these different templates in MOIS would have this ellipse, and you would be able to actually fill in each one. And like Ian's saying, he gets his patient to do it. And we can talk about different ways that we actually work on to do this in our EMRs. We can actually look at workflow issues through the case study. And that's exactly what we're talking about. Different practices have different ways, right, of addressing this. Looking at the rest of the tool, what we have is all the different tools that you would have in the PSP module, right down to the daily morphine equivalent dose, as well as things like pain scales, et cetera, et cetera. Okay. Each one of these would have a little hide button. So right at the top here, we can just do that. We'll move on. We've got the red flags, which help us determine, is this something more than chronic pain, something organic going on, something we need to investigate. And if there's no red flags, we just click on this. If there is a red flag and we do click on it, it comes up alerting us there's items checked below. So we can do that there. We have yellow flags as well. And if you're like me and you look at it and go, what is a yellow flag? There's a resources section at the bottom for the provider, right there. And if we scroll down, you can actually see you've got a yellow flag section that will go into the algorithm and actually explain what exactly is going on and what is a yellow flag. So there's always resources for you in here as well. If you'd like to start opiates, we have the opiate risk tool, a patient agreement letter. It's pretty self-explanatory. If you want to document any adverse effects, and anything that has happened has come up here on the side with a date around it as well. If you'd like to document the non-pharmacological means of managing this patient, there's cognitive therapy, psychiatric services, and exactly when you had done this before would come up here on the top, looking at the date. And let you know when last you actually had done this, or is the person actually using it. It could be that they're planning to. This is basically a tool saying, what are you planning to do? And that's a great question. You know, is this basically a goal that you want to set with the patient? You know, that kind of thing. It could be a planning to. It could be really something that you could decide on. You know, do we need to have a brief action plan done? So if you want to say that, yeah, we want to do a brief action plan, you'd actually click on that, and that would bring this up. And then you'd decide, yeah, you know, this is a really good thing. We want to do a brief action plan. So we should go to our goals folder in MOIS. And I'll just put this up here. and then we can actually put it in as a goal. There is a clicking button in here, but because of the resolution, it's kind of hidden. So there's a hyperlink in the template to take you directly to this place. Okay? On non-pharmacological management, right at the bottom, it says goals, brief action plan, and then go to this goals folder. You click that, and it'll take you right there. Okay? Okay, pharmacological and surgical treatments, basically it's the same sort of clicky box. What is this patient on? You know, we'll just say oral opiates and this. And if you want to give the patient a handout, if you want to do box breathing with them, have you actually given them the opiate treatment plan? You know, you'd actually click it here saying that was given at this date, and then it would put the date in to say that, yeah, you'd given it to the patient. Okay, so is everyone ready to take this for a drive? Now comes the audience participation part. So we're going to look at Brad Stevens. Brad has acute shoulder syndrome, and he is a 38-year-old single man who injured his shoulder 3 days ago. Comes in saying, I need something for pain. He's a golf club manager. Over the May long weekend on a Saturday, he was quite busy, and he pulled on a cart, and basically he's saying, I've got right shoulder pain, and it's excruciating to move, doc. I've taken Advil, taken ice, it's not working. It's my busy season, and I need something for pain. So the first question is, how would you approach this in the office? Would this be a person that we would use the template for? Kind of shaking your head, Susan. Any other takers there? Well, not truly, because this is an acute injury. This is a SOAP note. You know, he's come in. We're going to assess him. We're going to find out, yeah, you know what? Provide him with acute injury protocol, RICE protocol, send him to some physiotherapy, and that's exactly what we would do. And unfortunately, 2 weeks later, Brad comes in again saying, you know, doc, I've been following your advice. I'm doing the drills from the physiotherapist. I'm taking Advil. But now my pain's worse than ever. I'm not able to sleep. I've got another busy weekend coming up. And you know, a friend of mine lent me 2 Percocet. And at least I was able to sleep. There's no changes in your physical exam. And he's now here asking for a stronger pain med. So, opening up to the floor, would this be a good time to set up the template or start the template? Okay, great. Would you give somebody a brief pain inventory? Would you use any of the tools? Sure. So it's a decision support tool, exactly right. So what we'd be saying is, yeah, you know, we want to know, okay, we want to start opiates here. So let's look at our initiation checklist, and we can, like Ray's saying, look at the opiate risk tool and decide whether this person will actually use it or not. We could also decide, is this a significant event? Is this not a significant event? We could tag it to our care plan. We could create a problem saying acute shoulder injury, question mark. This is the phase at which you start getting that inkling. Perhaps something's going on here. Perhaps this person is predisposed to developing a chronic pain syndrome. Okay, great idea. Okay, so Brad comes back. It's now 2 months later. It's mid-July. So we've asked Brad to actually do a brief pain inventory hand. And we can see that, you know, he's filled us in. He's got some pain over his shoulder. And he's actually filled in the different parts of the brief pain inventory for us. You know, he's circled it up. And the question is, you know, Ian would have his patient fill it in right there with him. You know, I would have. Right. Yeah. You would give it to the patient first, exactly. If we have pain assessment tools here, you know, we can actually have the patient fill it in like Ian is saying, and then have our MOA put this in for us, just like Brad would. And then we would save it and escape that. Okay, so, you know, Brad's pain and stiffness has persisted. We're coming back to Brad here. He wants to stop work. He's getting worried he's going to hurt his shoulder. His boss is getting mad at him. Does anything come out here? Is there anything in our template, in our tools that we could be using? What do you think? Yeah, his mood is worth checking. Absolutely, absolutely. If we have a look, he's got some yellow flags. You know, the belief that the pain is harmful and disabling. It's got some things going on there. What is the importance of it? Has anybody used yellow flags? Anybody applied it? Right. Do we need to get a resource such as a psychologist or counseling? Could that be part of our treatment protocol for this particular patient? Absolutely. So you can see that the tool is there to actually help you think through it, make a decision based on the information. Pain is a subjective experience, and what we're trying to do is make it as objective as possible and then create an assessment and plan after it. That's really what we're doing here. Okay, so Brad's come back 9 months later. He's got specific questions. There is now a second BPI that you do in the office. And if we remember the first one, you know, really it was his right hand that was, or right shoulder that was injured, but he filled in the left side on his first BPI. And if you have a look at his second brief pain image, you can see now he's also filled in the left side, even though he injured his right shoulder. And you can see that things have progressed. He's now filling it over here, and he's filling it over there. And his scores, as you can see, he's added a plus over here. You know, it's really on, things are getting a little difficult to manage, okay? How would we capture this information, the brief pain inventory? How would we do that in MOIS? What about the picture, right? How do you get the picture back, right? So is it important for us to have the picture? What I do is I scan it. Yeah, I scan it into documents. And then I tag it to my care plan for chronic pain. So that anything that's important to chronic pain, I tag it to my care plan. Because I have the same problem, Susan, finding information that's buried in a chart note. But really, in my care plan is where I have all the things that I think are, you know, pertinent to this particular person in a way that I can access quickly. Okay, let's tag something. Okay. So here's a form. The patient filled in. You know, I put it in. This is his first brief pain inventory that he actually had. Okay, so this is in documents, right? And if I right-click on it and I tag to care plan, it goes in there. And I want it under my general section. Okay. So if I ever want to say, you know, what's our whole overall plan? If I don't have a flow sheet, or if I have a flow sheet, I open up my care plan. And, you know, Mickey's got a lot of stuff going on because we've used him as a test patient. So this poor fellow, you know, has a lot of stuff. But under the general section, I can see that there's now a patient form. And if I hyperlink it, it goes straight to where that is, and it's not buried in my documents. So it's just a different way of accessing and sorting information. Anything? Yes, you can. You can untag it from the care plan, absolutely. So looking at Mickey, you know, what are the other things that we would do for him from our tool section? You know, he's now come back 9 months later. He's frustrated. He's waiting for an orthopedic surgeon to see him. And he's really, really interested in using opiates. And we're considering using opiates. What are the other things you'd want to do on him? Could we consider, does he have neuropathic pain by doing a DN4? Right? So we could use that, and it's going to, I'll open it, and it's going to, yep. So we could decide, you know, does he have neuropathic pain at all? And we could work this through here. So let's continue. How's his sleep? How's his sleep working? So we could look at, okay, do we use a PSQ3, which is a sleep tool? If you use the DN4 neuropathic pain, you'd find out, yeah, he's got burning pain to his fingers, and perhaps non-narcotic means of managing his pain is an option for him. So we could use that as a decision. Would you use a catastrophizing scale for the particular patient? So yeah, why would we use it for Brad? You know, we could see his BPI, the interference section is huge. So that could be a trigger for us to say, could we use the pain catastrophizing scale? Okay. Okay. So in starting the opioid, we do the opioid risk tool. We try and fill that in. And in response to the opioid risk tool, before we started opiates, we know that he became addicted to painkillers years ago after an ankle injury. He obtained them from many doctors and bought them on the street when he couldn't get them, stole money from his parents. Eventually, his parents funded his attendance at a residential program, and he was in NA for 5 years, and since he's not used any opiates. So using the opioid risk tool, you know, how do you think he'd score on the risk tool? Exactly. And so having that risk tool right there in front of you, you would actually be able to work through that and decide, is this appropriate or not? And as a provider, you can decide with your patient how you would like to address this and how you'd like to move forward, deciding it. Also on the opiate section, there is the treatment agreement letter, and there's a hyperlink to that. And you have 3 options with the treatment agreement letter: refused, given, and signed. I'm not going to go back into MOIS because the resolutions kind of jump in and out and it's disturbing for you. But that is a way for you to keep track of whether you've got your ticky boxes done. And just below that is a urine drug screen requisition. So you can go to your orders and you can actually see whether you've actually done urine drug screens on this patient or not. So these are all ways of safely prescribing if you do decide to use an opiate for therapy in this patient. Hopefully I was able to tell you how to access the pain template and how to use it in the context of a pain management visit, how to record patient data in a way that makes it measurable. Great. Well, thanks, everyone. Take care.